Breaking news coming in at the top of the show. From the UK, where Prime Minister Keir Starmer has announced the abolition of NHS England, promising to refocus the health service on patients and frontline care. Speaking to a packed audience, Starmer slammed the duplication of bureaucracy, revealing that NHS England's operations were costing taxpayers billions every year, around £200 billion. Actually, some figures suggest. The funds, he insists, should be redirected to critical services like nursing and patient care. NHS England has become an arm's-length body that drains resources, Starmer declared, and Health Secretary voiced strong support, calling the move a necessary step after the disastrous 2012 reorganisation.
To our allies on many occasions about the situation in Canada. On the question of tariffs, obviously, like everybody else, I'm disappointed to see global tariffs in relation to steel and aluminium.
All right, disastrous 2012 reorganisation had left waiting time soaring and patient satisfaction at a historic low. The decision follows a series of high-profile resignations, including NHS England's chief executive, Amanda Pritchard. The controversial overhaul comes just months after Starmer promised a 10-year plan to address the NHS's ongoing crisis in September, with COVID recovery, treatment backlogs and industrial strikes hanging over the system. While critics may question the wisdom of dismantling the national institution, Starmer stands firm. And what really is this reorganisation all about? How does it impact patients? How does it impact the taxpayer is really the key question. And let's get in Radhika Iyer to really decode that for us. She's joining us live from London to tell us what this means. Radhika, explain to us, decode for us the significance of this decision and how it, if at all, it impacts patients.
Yes, sure. So this is a decision that's just come in about an hour ago from 10 Downing Street. UK Prime Minister Sir Keir Starmer has scrapped NHS England with a view that this NHS, which is an abbreviation for National Health Service here in the UK, which began in 2013 when the Tory government was in power, was actually introduced as a way of, in a sense, a public service which can run from an arm's length distance of the government to be able to make it more efficient. It turns out, according to the existing Labour government, which at the moment is in power, that this has further burdened the exchequer, the state exchequer, and that the mismanagement of NHS England, according to Labour, is one which it deserves or aims to sort of now fix or put corrective measures into place. So what this means basically is NHS, which is National Health Services, which is a system, a social system, a public system of health, which exists and has been existing in the UK for several years, will now be under the purview, the review, the remit of the UK government. This particular transition from NHS England, which is a private trust, to be moved into the government's fold may take up to 2 years, but the aim is one, to save costs for the government. But the bigger aim and the more important aim, which is seen as one which is a socialist and a public policy, is that to reduce waiting times that patients often suffer. In any public system, in any growing democracy, in any growing country with a growing population, waiting times are quite common. To be able to meet with a doctor or a nurse for a health-related issue has been a big task for people living in the UK, but it has become even further heightened after COVID, after Brexit, and after several immigration issues that cropped up. But
Indeed.
further to all of that, the Labour government, of course, claims that it was the Tories' indecision or the lack of planning in the decision of making it a Congo body to make NHS run in a style rather autonomous from the government, and the aim is to bring down the waiting times. It will be interesting
Indeed.
to wait and see how smooth this transition is and whether waiting times
Radhika,
and 100 million could be saved every year.
Right. Radhika, Starmer said that we're making tough choices that prioritize people, not politics. And there are some reports that seem to indicate that the fact that NHS will now be completely under the government's control and the arm's length body would not be there could actually mean more politicization of the entity. Decode that for us and put that in perspective.
Well, it is a Labour government. It is going to focus on having public health systems under its remit. Like any Labour policy would. And that's particularly the reason why critics may say that this further gives full control for the government to make NHS run as if it's their own pet baby. However, there have been sort of evidences to show that the waiting periods have been awfully long. There have been evidences to show that there has been excessive spending by the NHS over the last several years. However, there is also not parallelly an increase in the pay structure for doctors, particularly for high-performing doctors. And of that, just as a reminder, a gentle reminder, and not so gentle actually, the Indian workforce in the NHS is not to be sort of ignored at this stage. At least 8% of the top senior doctors in the NHS are Indian doctors who have also been joining the bandwagon for an increase in pay structure. So the several problems that have been ailing the health of the NHS have now been put forth. Is this going to be a political battle, or will there be genuinely some sort of a corrective measure that is put in place? It's going to take time, though, because the transition itself could take up to 2 years for the change to be seen and for the government to take full control.
All right, we leave it there, Radhika, but thanks so much for joining us from London. But a very important piece of information that Radhika was just giving right now, which is, viewers, that the transition towards this new change and the new reorganization could take some time, and that is likely to have an impact on patients and, of course, on all that. Let's put some of those graphics on screens to really tell what is it that NHS is all about, why it's important, and why it impacts every one of our viewers watching this broadcast in the UK right now, which is that the NHS transition, when it happens, that Keir Starmer just announced, will take some time. It could be 18 months, it could be 24 months, and during that period, how the uncertainty could have a certain impact. Not the quotes, but the graphics pertaining to what NHS is all about. We should put that for our viewers to have more clarity on what this means.